we can always branch out and look at mold or mycotoxins or heavy metals or more toxic burden down the road. But that's the foundation first. And then I would say on top of that, if there's any type of chronic pattern where there's an emotional trauma involved that's more unresolved, definitely bring in a good practitioner, with some tools in their tool bag of NLP or EFT or EMDR or hypnosis, anything that you want techniques to get into the subconscious. But again, the healthier you are, the better the emotional stuff is to resolve. So if you're doing EMDR and EFT and NLP and you're eating processed food and crap, it can still work, but it's going to be better when your brain chemistry is healthier.
Oh yeah, amen.
Yep.
Well, think about all the people that are in talk therapy, and then they go eat a Subway sandwich for lunch, thinking they're doing themselves a good favor by eating turkey on wheat bread with processed cheese, and then they get mayonnaise or sweet and sour sauce on it, or whatever the heck they're doing, and then they feel like crap. I mean, so
Yeah. I'm not a big fan of talk therapy in the long term. I think talk therapy is good to kind of just consciously process something like how did this happen? Maybe you're learning some tools to enter into your life from a habit standpoint to fix whatever that issue was. But then most of that trauma sits in the subconscious area of the brain, which is where 90% of all your thoughts are subconscious. And so that's where you want some of these techniques like we talked about. But I think talk therapy is good to acutely process what you've observed, whatever your experiences are, and then talk about, hey, what can you do, as a person today, as an adult today, um, you know, from a habit standpoint to address it. But then after that, then you gotta, if you're in talk therapy months and months later and you're still just ruminating over the same thing, then it's a subconscious thing you got to work on next.
yeah, and look, don't let
Yep.
me talk people out of doing it. I'm not trying to do that. But what I'm saying is, I've had people that said, "Oh, yeah, I've been with this therapist for 3 years. And I meet with them every week or every other week." And I'm like, "Okay, and what do you do with this therapist?" "We talk." "Okay, and what else do you do?" "That's it. It's talk therapy." And I go, "Okay, you've been doing talk therapy every week or every 2 weeks for 3 years, and you still have anxiety that's this bad. We got to dig deeper." So, like I said,
Yep.
there's a role for that, but it's not going to get you out of the woods. The person who commented about um, the dysbiosis and the anxiety question, they also commented in here, said they did have a stool test that showed H. pylori. They had extremely high Morganella, which is one of those bacteria we've talked about, and calprotectin, which is gut inflammation, over 1,000. Fatigue and anxiety were the main symptoms. Yeah, we see
Yep.
this every day,
Yep.
all day.
Yep, exactly. Nope. I'm familiar with that case for sure. And inflammation in the gut can definitely create those type of issues, and got to get to the root cause on it too. And then someone writes in about Accutane too. I mean, this is super common if you get into the dermatology world. I mean, dermatologists, they either cut something, they burn it off with a laser, they freeze it off, or they use some type of antibiotic, topical or internal, or they use some kind of like synthetic vitamin A. That's it. Like that's the dermatology world, in a nutshell. And they tend to not get to the root. We're talking like more chronic acne, chronic skin stuff. They tend to not ever get to the root cause of how or why that's even there. Diet, sugars, junky omega-6, poor digestion, poor fats, poor proteins. They don't ever really get to the root cause of why that is.